So I'm Pete Brown and I work in the NHS, and I have a small private practice as well. Um, I'm a family therapist working in an NHS Foundation Trust in South London. I mainly do systemic family therapy and I run some parent classes as well. But over recent years, my interest has been around the idea of practitioner self-care, how we look after ourselves in the difficult work that we're involved in. It was in 2017, a few years ago now, I decided to run a one-day workshop on behalf of our Greenwich Children's Safeguarding Partnership, just a day's workshop thinking within a multi-agency format about how we nurture ourselves and, well, basically how we don't burn ourselves out within the pressures that we've had over the last few years, which I would say are linked to 10 years of austerity, lots of service cuts and increased demands on us doing more and more with less and less. How do we look after ourselves in this stressful environment? There's a particular exercise which I like to do, and that's around risk and protective factors, both at the individual level, the organisational level, and then at the societal level. And these are three overlapping bubbles, so that we look at, what are the aspects that sustain us in our work, both from ourselves, organisational responsibility, and then the wider society issues, and then the kind of areas that deplete us and where we may need to take action to prevent ourselves burning out. At the individual level, some of the protective factors are saying no, knowing your limits, taking time out to recuperate, taking at least part of a lunch hour, even if it isn't a full lunch hour. The individual, more stressful side would be not taking time out, putting others first all of the time, and feeling pressurized to take on additional work. And then there's the organisational and society level. But most people in the small groups find this a useful exercise, just to think about what do we have control over in managing our workloads and what is beyond our control. Professional sustenance and depletion is an interesting one. 2 columns. What is it that sustains us on the left side, and making a list of that. And then on the other side, what is it that depletes us in the workplace? Actually, I find that practitioners can usually find what depletes us very easily, but the beauty of the workshop is I think it also focuses on things that we're still doing well, things that we still enjoy despite the pressures. That's one exercise. There's a number of different exercises, both theoretical and practical. An important aspect is to introduce some mindful exercises, but not just the internal mindful exercises that we tend to be more familiar with, such as the 3-minute breathing space, but also what I think has been called extra receptor exercises, where we focus on things outside of us. A typical one would be doing a tree scan of a beautiful tree or any tree in front of us, looking at the branches, thinking about nature, instead of looking at our own body and thinking of a scan in that respect. It's just a variation. And I think the workshop is a sort of reminder of how we need to reinvigorate ourselves from time to time. It's so easy to get caught up in doing mode and the demands of the workplace, particularly as there's so much pressure, as I've said, in the caring professions at this time. So I think I see both professional and personal self-care as a back and forth process. Sometimes we're better at it, other times it falls to one side. And I think the workshop helps people to remember what we need to do to help sustain ourselves. How we look after ourselves in the workplace, I think, depends very much on the culture of the workplace. Some management cultures do pay more time and attention to practitioner self-care and are mindful around caseloads and keeping an eye on making sure that there's time out for lunch hours and things like that. Other places have a culture of overworking, which unfortunately can be role modelled by managers. So I think we have to diplomatically, if that's the case, talk to, discuss it in team meetings, use our systemic skills to bring ideas out in a facilitative way that doesn't, meet people head on, and think about how we might make, small ripple into hopefully changing the system for the better. I mean, just to say, if you get a depleted practitioner, what kind of service are we offering our clients? So the idea is, the more we're able to look after ourselves, the more we're going to be able to be, in the service of others. I think we have to ring fence a portion of our time to think about how are we coping emotionally with the demands at the present time. I mean, if COVID has done anything, it has given a bit more of a focus, I think, on self-care. But I think we have to keep coming back to it, otherwise there's a risk of it falling off the agenda. In a way, I don't know, I see us all as therapists who often put other people's needs before our own. I think we have in the past had an implicit contract that our caseloads and the work would always be manageable. I think times have changed now. There are much more pressures on all of us. And I would like to see little reminders brought in from time to time, just to keep self-care on the agenda. How are we doing at the moment? Is it sort of fairly good? Is it medium? Or has it gone a bit off the radar? If it's gone off the radar, how do people feel about that? So I suppose it would be self-reflexivity to relational reflexivity, but in thinking about ourselves and our self and mutual care within the team context. I think it's useful for us to have a little barometer of where we are in terms of self-care. I often use these matchsticks, which are from the front cover of Context, from doing extremely well to very burnt out. And I think if we are in this area around this end, it is time to regroup, think about where we are, and think about how we're going to move ourselves up the scale a little bit. On the last page of Context, actually, there's some self-care activities where I asked all 24 authors to talk a bit about what they did to relax. And they've been grouped under community, creativity, exercise, reading, work-life balance, even technology. And that can be a good starting point. So I would encourage anyone who feels they're on the burnt out or burning out side of the matchstick line to think about what activities they've been involved in the past, what's sort of fallen off the radar, and what do you need to bring back in order to just move things back in a direction of a little bit more work-life balance. But do use the self-care activities, the list of them in Context, maybe as a point of sort of thinking about what the possibilities are if they've fallen behind a bit. So if anyone wants to know more about Context and this particular theme on self-care and the systemic dimension of mutual care, do please order a copy if you don't have one already. And I'll be very happy to send the workshop slides out if you're thinking of running any workshops on the resilient practitioner or other aspects of self-care.